Like many physicians, Dr. Barbara Lukert had a profound experience with a doctor early in her life.
I think probably what influenced me a lot was when I was 6 years old, my mother was really sick, had a ruptured appendix. And at that time, that was really an ordeal, you know, no antibiotics. The doctor that took care of her lived in Horton, Kansas, which was about 30 miles from where we lived.
She remembers the comforting effect the man's visits had on the family and decided she wanted to be that comforting presence in people's lives.
I think that the thing I really liked was that, you know, everybody was always so glad to see him because they're always kind of anxious about, you know, you think things are really going okay. And I remember sitting there thinking it'd really be nice, you know, to have people really feel that way.
Dr. Lukert completed her undergraduate at KU and then was accepted into the class of 1960 at the KU School of Medicine with a total of 5 other female students.
Probably the people that really influenced why I went into internal medicine and endocrinology were Bob Bollinger and Mark Dodge.
After a rotating intern year at St. Luke's, she returned to KUMC to do an internal medicine residency and fellowship in endocrinology under Dr. Robert Bollinger, who became her mentor.
And so then I came over here for my residency, and my first 6 months of my residency was with Bollinger. And he, of course, you know, was a fascinating man. And so I got interested in we saw a lot of endocrine patients because, you know, even though it was a general medicine service, he saw a lot of endocrinology. And I found that really fascinating. You really can't do private practice and any kind of investigative types of things. It just isn't time to do it. So I decided I'd like to go back to academic medicine. And I enjoyed teaching. And so I took a year. After I'd been in practice for 5 years, I spent about 7 months on a fellowship in Manchester, England, with Professor Stanbury there, who was in metabolic bone disease.
As an instructor of students and residents, she built lifelong relationships with most, if not all, of her mentees, continuing to be a resource and an interested colleague for any former student who sought her input and advice. Due to this connection, she has become not only the role model of the physician-scientist, but also the model of academic dedication to teaching as well.
She's had papers published almost on an international basis. So she kept up a very active, productive research career along with her clinical research and her patient care, because she never gave up on patient care.
Her advice to students after her years of experience boiled down to see as many patients as you can, always keep the patient as the main focus, and learn about the life of the patient so that you have more than a medical relationship with them. Don't be focused only on the illness and the business of curing it.
And there couldn't be a more excellent role model for medical students, whether they be in Salina or Kansas City.
Over the years, Dr. Lukert has embodied loyalty and dedication to the KU School of Medicine.
And I think that's still true. I think that we can be proud of the school, and that I think Kansas graduates from medical school are really looked upon with favor.
Dr. Lukert has been a scientist, professor, physician, and most importantly to her, a good human being. As the model of a healer and person, her own behavior is a clear guide to any beginning physician. The students and the doctors, lucky enough to have trained with her, have had a first-hand experience in exceptional patient care, research, and academic medicine.
She's a model to emulate, and I'm proud and pleased that I got to spend time with her through my years here.